Pakistan, Ghana, India, Libya. Okay, so we've got like candidates from all over the world. That's good. Hmm. Right. Nigeria. Where are you from? I am from India, but now in the UK. Right. Nigeria, Dr. Prince. Great. Okay. So it's going to be, as I said, it's going to be a very basic sessions on PLAB2 introduction. So brief PLAB2 introduction we'll be doing. And then we'll be answering your questions so that you'll be having. Okay. You look like South Asian. Okay. Good. Dr. Ali from Pakistan. Right. Right. And just want to know, like, all of you have booked your exam dates or not yet? And if yes, what are your exam dates? Tell me, 15th July, Dr. Mohsin. Not yet. 12th of June, 17th July, September, somebody said, August, June 14, April 17, and July 17, 11th July, 8th August, 8th July, June, July, April, May, June. So June, July, this is what I feel is most of the candidates are June, July. September, July, June. Right. Okay, perfect. Okay, 2nd of July. There are many on 2nd of July. So you can make a group, huh? Those are on 2nd July and practice together. Perfect. Right. So let's begin. Let's begin slowly. So I'll give you a bit of overview about PLAB2. What are the things that you should be expecting, right? Obviously, when you will come for the courses, the things will be done in very much detail. So I'll just give you a brief idea about PLAB, right? So but confused which academy to join. Let's hope this session clears. Okay, see, I'll be, of course, biased. I'll be telling my academy only. So you can do your research, doctor. That's the main thing I would say. But yes, what we can tell you, what I can tell you, what we do offer in our academy, right? Then, of course, you have to make your decision and your research. Right. So what I would say, what's PLAB2? PLAB2 is an OSCE exam, right? OSCE exam. We have given a lot of exams in our life. You have given your university exams, you're given PLAB1, right? So it's a different exam where mostly they're checking your medical knowledge, right? In our medical school, every single exam is based on the medical knowledge, how much you know about that particular subject. When it comes to PLAB1, that's MCQ, and of course that is also checking your medical knowledge. But when it comes to PLAB2, it is OSCE exam. What does it mean? So you will be actually doing the consultations. You will be doing the consultations. That's the thing. You will be having your patient in the cubicle. Right now, the patient, are they gonna have real patient? Not really. So they will be having professional simulators. They will be having professional actors actually. Right? So that is the thing. Now, so what happened is in this exam, how long this exam lasts and how it works. So you'll be having 16 stations. So 16 station, you'll be having 16 different actors sitting in 16 rooms, right? Each station will be of 8 minutes. So you will be getting 8 minutes with each patient or with each actor. That's how it's going to be. And there will be a task outside. So they will give you a task. What are you supposed to do? For example, in this station, are you supposed to do examination? Are you supposed to do history and management? The management is with the patient. The management is with the examiner. So everything will be given to you in that task. Right. So what happened is 1 minute and 30 seconds you will be getting to read the task outside. All right. So 16 station, 8 minutes each reading the task, 1 minute 30 seconds. So overall, you can say you will get 9 minutes and 30 seconds for each station. And in the exam, what happened is you'll be having two rest stations as well, somewhere in between. Because what happened is uh, 16 station in a row, it's very difficult for us to do because 9.5 minutes for each station. So total duration of the exam is roughly 3 hours. And of course, it's not easy to talk for 3 hours in one go, right? So that's why what they have is they have got two rest stations as well. Right? Rest station can be any station, can be anywhere, maybe your first station, maybe your second station, but for some, it's going to be somewhere in the middle as well. So that's how it works. And total duration of the exam is 3 hours. See, it's not easy to talk for 3 hours. So make sure you have some energy left, right? Because what happened is the candidates, when they go for the exam, so as we have seen, and there are a lot of candidates having exam on 2nd of July. So what happened is they go there, they know each other, and they start practicing before the exam starts. So what happened is you feel tired. So it shouldn't be the case, right? So what you should be doing, make sure you have got good energy, and 3 hours is not like a little time. It's not easy. You have to talk. And the station that you're going to get, it's going to be from all the departments as well. For example, you'll be getting the scenarios from medicine, from surgery, gynae, pediatrics, psychiatry. You'll be having some counseling stations, some ethical scenario, breaking bad news, medical error, angry patient, demanding patient. You have examinations, you have got prescription, you have got SIMMAN, lot of scenarios. I mean, all the scenarios you will see. So maybe one SIMMAN, one prescription, two, three examination, one, two from medicine, one gynae, one pediatrics, one psych, two, three counseling, two, three ethical station. That's how you get. So that's how it makes it 16 station in total. Right? Before COVID, they used to give actually 18 station, then they made it 15, and now they have made it 16 stations. Right. So what happened is uh, this exam, this is how you get the results actually when you get the exam result. The marking is actually done on three domains. The marking is done on three domains. Three domains are data gathering, second is clinical management, and third is IPS, interpersonal skills. So these are the three domains that are actually marking us. And each domain is of 4 marks. Out of 4, you're going to get score. And the total score is actually 12 for all three domains. So total score is 12. So they will give you the full detailed result, like for station number 1, for example, how much you got for data gathering, how much you got for clinical management, how much you got for IPS, interpersonal skills, and what's your total score, what was the score needed to pass that particular station, whether you failed or passed that station. So that is how you are gonna get your result. The detailed result will be given to you. Now the marking, we need to understand the marking. So what happened is they're going to give you, in each domain, they're going to give you 4, 3, 2, 1, or 0. That's how they're going to score us. Now, before you prepare for any exam, what you need to know? You need to know the passing criteria, isn't it? That is really important. So number one is you need to pass 10 out of 16 stations. So what we said, we have got 16 stations in total. So you have to pass 10 out of them, right? Second criteria is get above the average score. First of all, see, I'm not very sure how good you are in mathematics. Let's see. So we have got 16 station, as we said, and 12 marks each. So how much is the total? Tell me, guys, in the chat box. Let's see who is quick and who is good in maths. No one is good. 172. Come on, Dr. Muhammad, we're wrong. 168. There are a lot of wrong answers as well. But yes, it's 216, not really, doctor. Now 16 stations. 216 used to be when we used to have 18 stations, right? So it's 192. Yes, 192. So the total score is 192, guys, in this exam. So what is the passing score? What do you think? It says get above the average score. So what's going to be the average score? Any idea about the average score? 116, 160, somebody said. Oh my God. Doctor, 160, if you get, you will be the topper of the class. Good, 130. Okay. 100, somebody mentioned. Okay. The thing is, the passing score is going to be different on different days. For example, for PLAB1 as well, what happened is the passing score is different on different days. Same here in PLAB2 as well. So I would say the passing score is around 110. That's what I would say, around 110. I've seen it less than 100 as well. I've seen like 89 one day, and I've seen 112, 115 as well. So it keeps on changing. It keeps on changing. It's not fixed. It's not fixed in PLAB 1. It's not fixed in PLAB 2 as well. right? So what you have to do, you have to fulfill both the criterias. You have to get above the average score, which will be decided on that particular day, how many candidates are appearing. So the passing score is going to be, the average score is going to be calculated amongst those candidates, right? So you have to get above the average score and you need to pass 10 out of 16 scenarios. So make sure you fulfill both the criterias, right? So I've seen some candidates, they're passing maybe 11 station, but they're not getting above the average score. I've seen some candidates, they're getting above the average score, but passing only 9 station. So you need to be very, very careful on this thing, because that won't be considered as pass if you're not able to fulfill both the criterias, right? So what you need to do, so if you got a station, you know it really well. I mean, don't think I have to just pass it. Think I'm gonna get 11 and 12 in that station. That should be your aim. For a station, you are like, I'm not sure what is happening here. Okay, let's leave it. I don't want to do this station. Don't do that. Try getting as many as marks you can. You're not good in one station, that's absolutely okay, because you have to pass only 10 out of 16. But in that station, when you don't know much, still try doing your best. Still try getting some marks there. Because if you fail with 0 or 1, I mean, you got 0 or 1 in that station, it's going to be difficult to compensate. So you need to be very careful on that, right? So that's the result. Another result sheet they give is this one. So what's that one? So we know there are 3 domains: data gathering, management, and interpersonal skills. So what happened is they're actually marking us on these 10 skill areas. So what are they checking? They're checking, how is our consultation? Are we able to make the diagnosis or not? How was our examination? Whether we were able to interpret the findings properly or not? Whether we address the patient's issues or not? The language, our language. Right. Sorry, guys. I'm back. I'm back. Right. Okay, I think you can hear me now. You can see me now, right? Right, perfect. Okay, yes. So, yeah, so language listening, I was saying, and management. So, how we are doing the management, that's what they're looking for. And rapport, that's very important. How you're building the rapport and the time. So these are the 10 skill areas. Let me go a bit more in detail. Yeah, I'll go in detail, Dr. Hira, don't worry. So these are the 10 feedback statements, right? And then another thing that if you'll see in this result sheet, there are some ticks as well, isn't it? You might be thinking, I did really well because I got a tick. No, it's not the case. So if you see, you have got it in station number 1, you have got a tick on consultation, you have got to take in listening as well. What does it mean? What does it mean? It means for station number 1, your consultation skills and listening skills were not up to the mark. So it's not good to be having, I mean, these ticks in the sheet. All right. Okay, let's have a look at feedback statements. Consultation, first of all. So what do you understand by consultation? So what they want is they want a smooth consultation. What do you understand by smooth consultation? It should flow like, you have got presenting complaint, then you have got past medical history, then you have got lifestyle history, you have got some differential. So there is a pattern of doing a consultation, right? What happened is sometime we're taking history, we are in the presenting complaint, doctor or patient saying that I've got chest pain, it's going to my left arm, it's going to my left jaw. We know it's something serious. And instead of asking other symptoms, ruling out differentials, what we do, we think, okay, smoking is important. Do you smoke? Yes, doctor. But we are like, oh, I didn't ask for shortness of breath. I didn't ask for sweating. Let's go back. So when you're jumping from here and there, your consultation is not smooth. It is not logical. It is illogical. And that's why you get a tick in consultation, right? So go with smooth consultation. It should flow like that. Smooth consultation. All right. Second is issue. See why patient has come to you, because patient has got some issue. Are you able to recognize that issue? Are you able to solve that issue? For you, that issue might be very small, but it's not small for the patient. So be very, very, very careful on that as well, right? So issues, definitely patient is going to raise some issues. Another thing, some candidate asked me in issues, uh, should I do, if I have a patient, should I do non-medical management first or medical management first? Tell me guys in the chat box. Should I do medical management first or should I do non-medical management first if I've got a patient? Non-medical, start with medical, non-medical, medical, non-medical, ask him. Okay. Non-medical, non-medical first, non-medical. Okay, let me answer it now. I would say, I don't know now. I will see the patient and then I will decide, isn't it? It's not always about what patient wants, isn't it? You have to see the emergency part as well. Tell me one thing. You have got a patient in the A&E. Patient is saying, I can't breathe. And when you see the saturation is 85, and you are giving non-medical advice, do not smoke, don't drink alcohol. What do you think examiner will think about us? Were we able to address the issue? Not at all. So, are we going to do medical management first or non-medical management first? The answer is it depends on the patient. It depends on the scenario. Just see the scenario. Some scenario, when it is counseling scenario, you're counseling somebody for diabetes, for hypertension, for cholesterol. Obviously, we can go for non-medical first and then medical. But if you got an emergency in front of you, how can we go for non-medical? It won't make sense, right? So that is the issue. And all these three areas, the consultation, sorry, the data gathering, management, and IPS, they're actually linked to each other. They're linked to each other. So don't think if I did really well in data gathering and even if I mess up the management, I'll get full marks for data gathering. It's not the case. Everything is connected. So be very, very careful on that, right? Findings. See, in the history, in the consultation, patient is going to give you some findings in the history. They're going to give you some in the examination, some in investigations. Are you able to get all those findings? Are you able to interpret what does it mean? Are you able to give the management accordingly or not? That's your finding. Examination. So in this examination station, did you do examination properly? Did you hold the instrument proficiently? Were you smooth in the consultation? Whether you took consent or not? So these are the things they're checking for examination, right? Another thing is diagnosis. Okay, now my question to you. When you're doing the consultation, will you be able to find or will you be able to diagnose all the patients? Tell me. While taking history, will you be able to make the diagnosis? It's not really easy, isn't it? Yeah, sometime yes, sometime no. I agree, I agree. So you tell me, guys, you are sitting in your clinic, you are in your OPD, your clinic. So patient came, you took the history, you're not very sure what's the diagnosis. What do you do? You have some provisional diagnosis in your mind, right? So what do you do that according to that? You accordingly do the examination, what examination you need to do, and what else you do? You do the investigations as well accordingly. This is what you have to do here as well, right? So you just give your differential. So just tell the patient that you have given me this history. I'm not able to come to a diagnosis, but I've got these two, three things in my mind. You gave me this history, so this is my diagnosis. You gave me this history, this is also my diagnosis. You gave me this history, this is also my diagnosis. I'm not sure what's happening. Right. So what I'm going to do, I'm going to do some further investigations as well. I'm going to do your routine blood test. I'm going to do your phlegm test. I'm going to do chest x-ray, urine dipstick, whatever. I mean, whatever the scenario is, accordingly, you will go for your differential diagnosis and accordingly, you will investigate the patient. And of course, you can definitely discuss with the seniors as well. Right. Can we give differentials in the exam? Yes, of course. I mean, when you don't have the diagnosis, what you will do? You will give differentials only. Right. If you got the diagnosis, obviously, see, if patient made it very clear, doctor, I've got pain here in the temporal area. It gets worse on chewing and combing. What is it? A giant cell arthritis, isn't it? So you can justify your diagnosis as well. Right. So, John, you mentioned you have got cough, you have got shortness of breath, you have got fever. You came in contact with your friend who's also coughing, having the same symptoms. You have a travel history to this particular country. And so all these things are taking me towards that you might be suffering from a condition called tuberculosis. So this is what you have to do. So when the findings are going towards one thing, you give the diagnosis, but with justification as well. I'm saying TB. Why I'm saying TB? Because you have cough, shortness of breath is there, you have weight loss, you have fever, you came in contact with your friend having same symptom, you travel to Tanzania, sometimes they give that history as well. So all these things are making me think that you might be having a condition called tuberculosis, but I need to confirm it. What I'm going to do, I'm going to do some further investigation. I'm going to do your chest x-ray. I'm going to do routine blood test as well. I'm going to take your phlegm sample as well. We'll be sending it for investigation, and I'll confirm it, and I'll start you on the treatment. That is how you need to do the things in the exam. All right. Then time is the most crucial thing. You might be having one thing in your mind that when I am talking to the patient, I should have unlimited time. Why they are giving me only 8 minutes? See, in real life as well, when you start working, you will see the GPs, their consultation is time bound. GP, they give only 10 minutes slot to a patient. There, they'll take history, they'll do examination as well, they'll put the patient notes, everything they do in 10 minutes. So that's why they have given us 8 minutes in the exam. All right. So 8 minutes. So how you will be able to find out this 8 minutes thing? It's quite interesting because see, in the exam, you're not allowed to carry your watches and there won't be any clock in the room. So how will you get the idea about the time? So as you know, you have 8 minutes in each station. So in the exam, what happens is you have got 1.5 minute to read the task. After 1.5 minute, when you're standing outside the cubicle, when you're reading the task, after 1.5 minute, what's going to happen? There will be a bell saying begin. Begin, you go in the cubicle. In the cubicle, you have the patient, you have the examiner as well. So what do? You introduce yourself to the examiner first. Examiner, this is Ankur, one of the doctors. And my GMC number is 12345. They will see, yes, they are examining the right candidate. They'll say, proceed, doctor. Okay, then you will start talking to the patient. With patient, how much time you have got? 8 minutes, that you know. So what happens in these 8 minutes? After 6 minutes, there will be a bell saying 2 minutes left. And then there will be another bell after 2 minutes saying move on to the next station. So you move on to the next station, you go out of the cubicle, and then you start reading the next task. That's how the exam is going to be. Now the question from my side. So you know you have got three domains, right? You have got data gathering, you have got management, and you have got your interpersonal skills. Interpersonal skills is like, okay, you don't have to spend extra time on that, but I really want to know now, how much time out of 8 minutes you think you should spend on data gathering? How much time for management? What do you think? Tell me. Two. No, doctor, you have got complete 8 minutes. No. So IPS is to make the patient comfortable, rapport building. I'll talk a bit more on that as well. So how much time for data gathering? How much for management? I got 6-2, I got 4-2-2, 6-2, 4 and 4, 4 minutes each, 4, 5 and 3, 4. Okay, good. See, you don't have any bell after 4 minutes or 5 minutes. You have only one bell after 6 minutes. That's one thing. But see, data gathering 4 marks, management 4 marks. So you have to give equal importance to it. So 4 minutes roughly for data gathering, 4 minutes for management. That is what you have to do. Be very, very, very careful on this part. Right? 4 minutes for data gathering, 4 minutes for management. Of course, you don't know about the time, but practice in a way. Practice in a way. So when you practice with the timer. And instead of 8 minutes, I would say put 7 minutes timer. I think that would be much better. So when you put 7 minutes timer, so you try to do things a bit quickly, right? And you don't want to ask unnecessary questions as well. So your consultation is going to be good. And when you go for the exam, you'll have an extra minute as well. When you have an extra minute, you feel like, okay, this is doable. I can do it, isn't it? So that's something you have to do. You have to be quick in the data gathering. You don't have to ask unnecessary question. See, I always say one thing. Who's a good doctor? Who gives less medication? Who asks less question? Right? I mean, if patient has got 10 symptoms, you're giving 10 medications as a symptomatic treatment. Come on, you are not a doctor. Who's a doctor will find out the cause why this patient has got these 10 symptoms and treat the cause. That's what you have to try doing, right? Same with same thing with the this in PLAB. This is what you have to show it to the patient, right? So 4 minutes data gathering, 4 minutes management. So data gathering, important question you need to ask, right? Important question. Not everything. If you are asking everything, then what's the difference between a medical person like a doctor and a non-medical person? They can hire a non-medical person if they have got tick boxes. So you have to ask all these questions to every patient. It doesn't make sense. For example, smoking, alcohol, diet, physical activity. Do I need to ask these questions in all the station? Not really, not really. It depends what I am dealing with. If I'm dealing with a lungs scenario, my main focus is on smoking. I'm dealing with something related to liver. My main focus is on alcohol. That is something that you need to show. You are dealing with the case of lung cancer, occupation of the patient is important. You're dealing with the case of bladder cancer, aniline dye, that is really important. You're dealing with the case of back pain, lifting heavy object, where are you working, which industry or where you're working, that is important. So it's not important in all the cases, but in some cases, definitely it's important, isn't it? So this is what you have to do in the exam, right? If you are sure about a diagnosis, do I need to rule out? See, if you, after taking history, if you are sure about the diagnosis, do you still need to rule out some differentials? I would say yes. You still need to rule out some emergency differentials, some killer differentials. Let me give you one example. You got a patient has got sinusitis. Sinusitis, I think it's common. Yeah. And I think most of you have had this in your life. Yeah, sinusitis. Sinusitis is simply you have got mild fever, you have got a bit of headache, maybe here, and you have got runny nose, which is clear fluid is coming from your nose, and you feel a bit uneasy. That's a sinusitis thing, right? Is it something to worry? I don't think so. Is it viral, bacterial? Mostly it's viral, right? So now, Dr. Ali, you made the diagnosis. You made the diagnosis that it is viral sinusitis. Fine. But do you need to rule out the differentials? Yes. See what examiner wants to look for. I always say one thing, this hope for the best for your patient, but think for the worst as well. So, viral sinusitis, nothing to worry, relax, chill, and just take some paracetamol, some cetirizine, or maybe some nasal saline, and all we can do nasal wash. That's the management, nothing much to worry. But as I said, hope for the best, but think for the worst. So, what you need to do here? What you need to do here? You need to rule out the complications that it can lead to. You need to rule out the red flags. You need to rule out the emergency things. See, discharge is clear. Okay. Any blood with the discharge. Yeah, but this infection here can go here, otitis media. This infection here can go here, meningitis as well. So that is what examiner wants to look for. That's why I'm expecting some questions from you, like any ear pain, any ear discharge, any rashes, any neck stiffness. No, 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 doctor. Done. Now you are done with your history. And when in the end of the station, when you are closing the statement, you need to give warning signs as well. Like viral sinusitis, nothing to worry. However, if you feel that your discharge is becoming rusty, it's becoming like any certain color, your fever is very high grade and all, make sure you come back to us. So you need to do that thing as well. So that's what happens. So yes, you need to give, at least you need to rule out a red flag differentials. Right, language. What do you understand by language? See, you have to use very simple language. You're talking to the patient. They are not medical personnel, right? So talk to the patient in their language. Don't use medical jargons. Listening, be a good listener. In most of our countries, we see so many patients in a day, right? So you may be seeing like, say, 100 patients in a day. So you don't have much time to listen to them, right? I'll tell you one thing. So what happens is when patient comes to your clinic, tell me honestly if this happens or not. Just say yes or no. So you are sitting in your clinic, patient comes to you, you haven't started talking even, but you start writing the prescription. Tell me, does it happen in your clinic? Yes, yes, I got a couple of yes. So now tell me how patient-centered approach in the UK. Yeah. So many of the candidates wrote yes, couple of them wrote no as well. The thing is, see, in our countries, I don't blame anybody. I don't blame myself. I don't blame you guys as well, because we have to see so many patients in an hour, for example. But here, patient is important. Patient is important, right? So we have to listen to them. Be a good listener. To be honest, when we come from all these countries, Asian, African, any country where you're from, we don't have much time. But here, you have to listen to the patient. We are in a habit of talking, but no, you have to change it now. Now you have to develop a habit of listening here. That's the thing. Britishers, they love talking. So what you have to do, listen to them. And it's an art to listen as well. It's not easy to listen, right? You also feel like, oh, I need to talk as well. No, listen first. So listening. If patient is talking a lot, it happens sometimes patient talks continuously for 2-3 minutes. What you should do? Are you going to interrupt the patient? Not really. So how will I come back in the station? How can I still get marks? I'm not talking. Still, can I get some marks? Yes, you can get marks for good listening. So when somebody is talking and talking for a very long time, show them active signs of listening. What does it mean? So patient is talking, you listen to them. Okay. Yeah. Hmm. Nodding your head, saying, okay, this is known as active signs of listening. It means you're listening to me. That's the thing. You're not dozing off. You're not sleeping in between the consultation. That is really important. Okay. Then what we have is the management. So management is obviously things that you have. Just a sec, guys. Just right. Sorry, guys. That's some network glitch. Yeah. Okay. So that's what I was saying. Management. So management, what they say is management definitely includes safety netting and warning signs. So safety netting, warning signs, follow up. You can't afford to miss these things when you're doing the management. In this country, it's like a thing. Always what we have to do is we always go with like always safety netting. So when we are discharging the patient, for example, I was giving this example of sinusitis. So of course, it's nothing to worry. But when we discharge the patient, say, okay, you can go home, but always come for the follow-up. And if you develop, like, say, any pain in the ear, discharge from the ear, any photophobia, or for example, like your fever is too high, not getting better with the paracetamol, come back to us. So that's your safety netting or warning sign. In this country, GPs, they will never let you go out of their clinic until unless they give you follow-up and warning sign. That is must. Safety netting and the warning sign is the same, doctor. So safety netting, you're doing safety netting. So sinusitis patient, now you're discharging, you tell them as a part of safety netting that if you develop, you're doing the safety netting. If you develop a high-grade fever, if you have got rusty sputum or rusty discharge coming, or your fever not subsiding, say in 2 weeks' time, you have got pain in the ear, or you have got, like, say, a photophobia rash, make sure you come back to the hospital. That's your safety netting or warning signs, right? Now, what is repo? How you build the repo? See, there are a lot of things. So when you are in the exam, you're not just talking from here. You have to talk from the whole body. Your body should talk. Body language, how active you are. You have to dedicate these 8 minutes. 8 minutes you're spending with one patient. You need to dedicate it in a way that these 8 minutes are only and only for you. Very actively, you have to sit on the chair. Some candidates have seen they're just sitting, relaxing on the chair. It's not going to work in the exam. You have to show that I am actively doing the consultation, right? You have to have that adrenaline rush. That's really, really important, right? So very attentively you have to sit and like professionals, right? That's what you have to do. Don't be with very dull posture. I've seen some kind of very dull posture, like just relaxing. Don't relax on the chair. You are there to help the patient out and make sure the 8 minutes are dedicated to you. That is what you have to show to your patient, right? Okay, what else in rapport building? I mean, acknowledge the emotions of the patient. Many times patient has come with something like, say, chest pain. Patient might be having a concern. Doctor, is it heart attack? See, patient might have asked you this question in the beginning, is it heart attack? So you can't answer that in the beginning itself, isn't it? Because you need to take proper history and all. So what do you do? Acknowledge, I can see you are worried about heart attack. Let me assess you first. I'll be in a better position to tell you what exactly is happening. So that is what you have to do in these scenarios, right? So rapport building, that's what you have to do. Acknowledgement of the patient's emotions. In counseling, in ethical scenario, you will see you have to do a lot and lot and lot in terms of acknowledgement. That's really important, right? Repo building. What's the dress code for the exam? So it's like what they say is what you usually wear in the hospital that you should be wearing for the exam as well. So what I would say is go with the normal shirt, not t-shirt, shirt. Half sleeve shirt or full sleeve, you can fold it because you have to be bare below the elbow. You have to be bare below the elbow. So full sleeve shirt, if you're wearing, you have to fold it. No watch, no bracelet, no ring, nothing. That's how it has to be. Right. And trouser, it's better not to go with jeans and leather shoes, no sports shoes. Female candidates, if you want to wear like your dresses, that's fine. If you want to wear heels, that's fine as well. Right. Can you wear scrub? Yeah, you can wear. You can wear the scrubs as well. That's fine. Right. This is what they say. I mean, what you should be wearing in the hospital, you should be wearing in the exam as well. So what my recommendation is, go with a normal shirt like any light color, say white color, light blue color, any, I mean, it doesn't matter, pink color, light pink, light color, I mean, that's the thing. And the trouser, again, any color, that should be fine. That you should, what about hair? As a man, long hair doesn't matter, doctor. If you have got tattoo, you have got long hair, it doesn't matter at all. It's absolutely fine. It's absolutely okay. Right. So this is about these feedback statements. Right. So tell me, do you want to listen a bit more about the PLAB introduction? I hope you are not bored. Yeah, please tell me if you're bored. You're bored? You're saying yes? Not bored. Okay, okay, okay. Right. So now what I'll do, I'll give you a summarize, not very in detail, but I'll give you a summary of history taking. Usually we teach it like with the different slides as well, but with two slides, I'll give you overview of history taking. Right. About hijab as well. So yes, the thing is, if you go for the exam, if you're wearing hijab, they'll take you in one of the room and they'll make sure they'll click your pictures and all, and then definitely you can go with the hijab as well, right? That's fine. But the thing is, it has to be bare below the elbow. I mean, that is for sure. That's the thing, right? But if you are like covering your face and all, they are okay with that. But as I said, when the exam starts, so they will, I mean, before the exam starts, when they're doing the what do you say, the clicking the pictures and all, so they will take you to one of the room and they'll click the pictures and they'll just confirm if they are dealing with the right candidate or not. That's how it is, right? Okay, now how you will start the station. So what you have is you introduce yourself. You have to identify your patient as well, and then we'll start. So, for example, how I'm going to start the station. Hello, I'm Ankur, one of the doctors. May I confirm your name and age, please? So they'll tell you, okay, I'm John. My age is 40 years. Hello, John. Nice to meet you. How can I help you today? Always start with the open question. See, open question, close question. Always start with open question. Right. What does the meaning of open question? That means you are giving enough time to the patient to talk. That's open question. How can I help you? Patient said, I've got pain, maybe pain in the tummy. Now, sometimes we make a mistake when patient says, I've got pain in the tummy. I mean, you are like, for how long you have got the pain? Yeah, 2 days. What kind of pain it is? Don't do that. I know to elaborate pain, we have got a mnemonic, Socrates. Right. So it's site, onset, character, radiation, associated symptom, time, exacerbating or relieving factors, and the severity score. That is what we do. But first go with open question. Doctor, I've got pain. What you should be asking as the next question? Could you please tell me more about your pain? So when you're asking, tell me more about your pain, you are giving the patient enough time to talk. That's what you have to do. Right? That's what you have to do. So go with open questions. How can I help you? Tell me more about it. So what they're going to do, they will tell you half of things about pain, isn't it? They will tell you half of the things about pain and let them do that. That's the main thing. Now, whatever is left from this Socrates, you can ask by asking close question. For example, they told you about site, they told about onset, they told about character, they told about severity score as well, but still any exacerbating relieving factor time they haven't mentioned. So you can ask it by asking close question. So first open, then close question. So once you are done with the elaboration of first symptom, what should be your next question? Your next question is again an open question. What you can ask is there anything else? You have got pain. I have understood that. I've elaborated that. Do you have any other symptom? If patient says, I have cough as well, then what's your next question? Okay, tell me more about your cough. So elaborate the cough as well properly. So you have got like some other mnemonics as well. Odipara, for example, for cough, shortness of breath, we use these mnemonics, right? Onset, duration, intensity, progression, aggravating, relieving factor, and associated symptoms, right? Another thing, like if you have got fit, fall, loss of consciousness, vertigo, you take history in three ways: before, during, after, isn't it? That's how you take history. So the first open question, tell me more about it. Elaborate first presenting complaint. Ask about it. Do you have any other symptom? If patient has got second symptom, you elaborate the second symptom as well. Right? So if patient has got second symptom, elaborate that. After that, what's your next question? Anything else? Make sure you keep asking the symptoms from the patient first. But once patient said anything else, no doctor. Now what you have to do? So you have elaborated one or two or three symptom you have elaborated. So you will have some diagnosis or differentials in your mind. Right? Then what you will do, you will ask associated symptoms to confirm your diagnosis and you will rule out some important differentials. For example, you have got a young female patient. Patient has got pain in the right iliac fossa. Young female right iliac fossa pain. Differentials, tell me. Ectopic pregnancy, right. Appendicitis, ovarian cyst, torsion ovary, UTI, salpingitis, okay, fine. Renal colic, okay, okay, we got so many, right, good one. Any other? Bowel obstruction, okay. Now, listen to the story now. Okay, how can I help you, doctor? I've got pain in my tummy. Your next question, tell me more about it. Doctor, pain here. So patient is showing the right iliac fossa part, the female patient. Doctor, the pain started yesterday. It started in the right area and it's still here. 5 out of 10. Dull pain. Now tell me, is it appendicitis? No, because appendicitis pain starts from the umbilicus, it goes to the right side. So that I have ruled out. Is it torsion? I don't think so. Torsion? No. Pain 5 out of 10. Torsion doesn't make sense. Renal colic? No. Pain is from loin to groin. Doesn't make sense. Bowel obstruction? Again, I don't think so. Severe pain patient is going to have. So what I'm left with? It can be ectopic. Could be cyst. That we'll see. UTI? I'll see. Could be what? Yeah, somebody mentioned STI PID. Okay, could be that as well. We'll see. Now, after elaborating the pain, after doing Socrates, what should be your next question? Do you have any other symptom? Okay, if I said no other symptom, doctor. So now what do you have? You have got so many differentials in your mind. So what you will do now? Let's start ruling them out. Now start ruling the differential and start making your differential or your diagnosis. So do you think it's UTI? I'm not sure. So let's see. Okay. Maria, do you have got burning sensation while passing urine? Are you going to the loo more often? No, doctor. No, doctor. Done. When was your last menstrual period? Doctor, 2 weeks ago. Ectopic, gone. Okay. Do you have got any fever? Yes, doctor. Fever is there. Do you have got any discharge coming from vagina? Yes, doctor. So what is it? Could be PID or STI. Now go for sexual history, confirm your diagnosis. You have asked associated symptom. You have ruled out some differentials as well, and quickly go for past personal history and finish it off. That's what you have to do in the history. If you actually remember these points properly, these points, you will be able to manage any single history in the world. Okay. How can I help you? Tell me more about it. Elaborate the presenting complaint. Ask about anything else. If you have got one, two, three symptom, based on that, think what's your differential, what's your diagnosis, rule out some important differentials and finish it off. That is it. Of course, when it is a fit for loss of consciousness, the history will be taken in a three pattern: before, during, after. That is a different thing. All right. How we rule out ovarian cyst? I mean, doctor, so when patient has got, for example, Patient has got what? Patient has got discharge coming. Patient has got fever. So it's going towards infection. And definitely for PID, I'm definitely going to do an ultrasound scan. And then obviously I'll be able to rule out ovarian cyst as well. Okay. But the history is going towards infection, EID, STI. Then take sexual history, and that will be the reason, that will be like how you will be able to confirm your diagnosis. All right. Then you got a lot of questions like for past medical history, previous symptoms supportive of ovarian cyst. See, sometimes doctor, ovarian cyst patient may not have any symptoms at all. They may not have any symptoms at all. That's how it is. They might have mild pain, but they may not have any symptom at all. Maybe it's asymptomatic, right? Okay, so past medical history, previous similar episode, any medical condition, any medication if patient is taking, a patient allergic to something, a hospital stay, surgeries, family history, smoking, alcohol in personal lifestyle history, diet, physical activity, stress, recreational drugs, sexual history, travel history, occupation, living condition, even sometimes driving status of the patient we ask. So there are a lot of questions that you have here, past personal social history. But the thing is, see, you don't have to ask everything here. You don't have to ask everything here, right? You don't have to ask everything in past medical, personal, or lifestyle. There are 20 questions. And if you ask all 20 questions, what's going to happen? These 20 questions is going to create problem for you. 20 questions, you have to at least spend 2 minutes of your time. You won't have that time. You don't have that time, right? So what you have to do is you have to be quick. You have to ask the relevant question. You have to ask a relevant question. That's the most important thing, right? So that's really important. So out of these 20 questions, maybe just you have to ask 4 or 5 questions, depending what is most important in this scenario. That is it. For example, I'll give you a couple of examples. Like, don't worry, I'll explain I, psychosocial, everything I'll explain. Just give me a couple of minutes. So, what is the meaning of past personal social? I mean, so why we are saying like these 4 or 5 questions only you have to ask. Okay, you have got a patient. Patient came for diabetic annual review. Patient is diabetic for last 10 years. Now tell me, is it important to ask, do you have anyone in the family having any diabetes? Is it important? I don't think so. See, patient is already diabetic for last 10 years. If my father, my mother is diabetic, it's none of your business now. I mean, it's not important. So if you're asking this question, it's useless. I mean, so you have to be very careful on these things, right? So patient gave you a history like, doctor, and the patient is 50, 60 years of age, my chest pain going to my arm, going to my jaw, very clear classic history. I've got sweating as well. I've got shortness, a classic history of MI. And then are you sexually active? Are you having stable partner? Do you take drugs? I mean, so many irrelevant questions if you're asking, examiner will not feel good and they will definitely cut our marks. So you need to pick and choose which question I'm going to ask. You got a respiratory case, smoking is important, occupation is important. Lots of questions are not important. Please leave those questions. So out of these 15, 20 questions, you have to ask only 4 to 5 questions. So do we need to take past medical history in each case? So what I said is past medical history, lifestyle, personal history, and social history. Skim through these questions. Think which question I need to ask. You don't have to ask every single question. If you ask every single question, you won't be able to finish the station on time. You will spend too much of time in the history. Your management will be compromised. Don't do that. In the end, what you can do is you can always ask, is there anything else that we should know? Patient's concern, obviously, whatever concern patient has got, keep checking that and later on make sure you address those concerns as well. Impact of the patient on the illness of the patient's life. So what is a psychosocial history? Psychosocial history. See, what kind of impact this illness has got on the patient's life. That is your psychohistory. I mean, psychosocial. So psychosocial means first is whom you are living with. If patient is living alone, living with someone, support is there or not. If you're discharging the patient, can patient look after themselves or if there is any support? That's why we ask whom you are living with. Another thing in psychosocial is, so patient has got tiredness for last 3 months. So how it has impacted your life, how this tiredness has impacted your life. Of course, we are going to treat the tiredness by finding out the cause, but patient might have had some burden on his mind as well. Mental health is very important in this country. So you have to ask to the patient how this tiredness has impacted your life. Oh, doctor, I used to spend time with my family. I used to spend time with my kid, but now I just feel tired and I can't do that. And I really, really miss that. So that is the impact of the illness on the patient's life because of this tiredness. And that is what you call as your psychosocial history, right? So how's the mood of the patient? How's the mood of the patient, whom you are living with, how this illness has impacted your life in general. All these questions comes under psychosocial history. Now, after you're done with the history, what you have to do? So you have to give your diagnosis. You have to give your diagnosis. But before you go for diagnosis, what you have to do? You have to mention about examination. You need to mention about initial investigations as well. So you're done with the history. So for example, doctor, I'm having a chest pain going to my arm, going to my jaw, and you did the history. Now you know what is happening here. So you know it's like angina or it is MI, ACS. That's what is happening. So which examination you would like to do? So we always say I would like to do your general physical examination. I want to check your vitals, your observation. I would like to do your chest examination. I would like to do your heart examination. Which initial investigation you think you should be doing in this case? Can I do routine blood? What else you think, guys? Tell me in the chat box. What investigation I should do for this patient? Shall I do ECG? Perfect. Shall I do troponin? Yes. So mention about these investigations, right? Routine blood include lipid profile as well, CBC as well, definitely. So now once you're done with ECG troponin, so what happens in the exam? Sometimes they will give you ECG, sometimes they'll give you troponin, they'll give you vitals of the patient as well. So what happens? With the history, when you have got these things as well, what happens? You'll be able to uh, give the diagnosis with more confidence. You see, doctor, I'm going to the loo more often. I've got burning sensation while passing urine. I have pain in the suprapubic area. I've got mild fever as well. Can we say it looks like UTI? I know you are thinking about UTI and you're 90% sure it might be UTI. So just confirm it. So what you can do in the initial investigation, mention I would like to do urine dipstick test as well. An examiner gave you the finding which says that leukocyte nitrates positive. What does it mean? UTI. You confirmed it. So after history, before you give the diagnosis, make sure you mention about examination investigation as well. And then you give your diagnosis on the basis of your history, on the basis of examination, on the basis of investigation. All right. And make sure, you explain the examination and investigation findings as well. What I mean by that. See, you said, okay, you are suffering from, or what we are thinking that you might be suffering from tuberculosis. Now justify the diagnosis. Explain the diagnosis. Tuberculosis is the infection of the lungs. Explain the diagnosis. Explain the history. So justify the diagnosis now. So we are saying that you have TB because you have cough, shortness of breath, fever, travel history is positive, and you came in contact with somebody having the same symptom. When I examined you, I found your temperature was high. And in investigation, when I did the investigation, for example, I got chest x-ray showing typical findings which are suggestive of tuberculosis. So I want you to give the diagnosis and justify the diagnosis as well. That is really important. Do we examine at all the stations? See, what happened is many station, what you have to do is you have to do the history and you mention about examination and they will give you examination findings. But some station, when the setup is for examination, when you go in the cubicle, there is a couch, they have got all the instruments on the table. You have got the mannequin as well. So it means it's a history plus examination station. So you have to be very quick with the history. You have to do quick history. You have to do quick examination and you have to do quick management. You're not supposed to do full history. You're not supposed to do full examination. You have to do relevant history. You have to do relevant examination. Right. So this is how you have to go. So when you give the diagnosis, you justify the diagnosis as well. Don't just give the diagnosis. Give and justify why I said this is the diagnosis. Right. Now, ICE. This is the biggest thing. What is ICE? ICE is idea. ICE is concern and expectations. And what I say is ICE is your biggest friend in this exam, right? It's the biggest friend in the exam. See, a patient is having, say, blood in the urine. So if patient has got blood in the urine for last 1 week, do you think patient has checked it on Google or not? Tell me honestly. I have got blood in urine, doctor, for last 1 week. So do you think patient has checked it on Google, on online? Most probably yes, isn't it? I mean, We will be worried as a doctor. If we get some problem, we do Google it as a doctor also. And doctors are the worst patient that we know, isn't it? So instead of telling that I'm suspecting you may have cancer, because it can be very blunt that you have cancer. So what we do, uh, you put all things together. That's the thing. So John, you told me that you're having blood in your urine, right? It's there for last 1 week. It's painless blood coming, and it's coming throughout your urination. You have got weight loss, as you mentioned. You have got appetite loss. You're not enjoying your food. You're feeling tired as well, right? So do you have any idea what's going on with you? So what I'm saying, I'm not going to say the word cancer in the beginning. I would like to get that word from the patient. So do you have any idea what's going on? But sometimes patients are very smart as well. They're like, I'm not sure, doctor. Do you think it's infection? Okay. So, John, see, there are many things it can be, right? It could be infection, and if it is infection, we can give you antibiotics and we can treat you. But, it could be something else as well. Are you concerned about anything in particular? Are you concerned about anything in particular? What do you mean, doctor? Is it something serious? Is it cancer? John, this is one of the possibility, and we need to investigate you further, right? And then you mentioned about the investigation, further investigation, and the treatment plans and all. That's how it is. Expectation, once you're done with the management, ask, is there anything else you are expecting from this consultation? So that's your idea, your concern, your expectation. Do you have any idea what's going on with you? Are you concerned about anything in particular? Do you have any other expectation from this consultation? I'll give you one other example for expectation, why it is so important. So you got a case of tension headache. See, tension headache is nothing to worry, isn't it? Tell me, guys, what's the treatment of tension headache? What's the treatment for tension headache? Rest, triptans, painkiller, tender, loving care, paracetamol, oxygen, stress relieving techniques. Okay, the treatment is stress relieving. That's the main thing. Tension headache, stress relief. That's the thing. 100% oxygen. No, that is actually, doctor, if you have got other kind of headache, not like cluster headache, we give oxygen, but not intention headache. Paracetamol can be taken, that's okay, but we don't want to give too much of painkillers as well to this patient, because patient can have pain because of overuse of painkillers. But short-term painkillers, that's absolutely okay. Main is relieve that tension. Tension headache because of tension. Relieve the tension and you'll be fine, isn't it? So that's the main thing for tension headache. And also you have to work on the lifestyle. Eat well, healthy eating, and go for physical activity and good diet. That is the treatment, isn't it? So you got a station on tension headache, and you did all these treatment plan like rest, some meditation, yoga, dietary advice, physical activity advice, everything you did. And you think you did well. And when you got the result, you got only one in the management. And you are like, "Ah, I did everything. Why they gave me only one? What's the reason?" The thing is, you didn't fulfill the patient's expectation. So if you ask what else you were expecting from this consultation, doctor, I'm looking for a CT scan. And you never talked about CT scan because this is not a part of management. But patient wanted that. Patient expectation was CT scan. I'm not saying that you have to do a CT scan, but you need to talk to the patient about CT scan, that it's not required in your case because it's tension headache. Moreover, the CT scan has got harmful radiations and we don't do it until unless it's required. So this is the importance of idea, concern, expectation. Many a times you will see after taking history and not very sure what's happening with the patient. So when you do eyes, they will help you out. Now question is where I should do eyes. Should I do it here where I have mentioned here? Or can I do it anywhere? You can do eyes anywhere in your consultation. Doctor, I've got blood in the cough. In the beginning, patient said, do eyes then and there. So do you have any idea, John, what it can be? Are you concerned about anything in particular? Do eyes anywhere you want in the consultation, but please do. Can I do I separately, C separately, E separately? Of course, yes. Can I do ice once, twice, thrice? Yes, yes, yes. You can definitely do, but please do it. It is the most important part of your station. And I would say ice is your the bestest friend in the exam. All right. So here we were. So you have to take history, then examination, then initial investigation, ICE. You do anywhere in your consultation, but please do it. And then you disclose the diagnosis, and then what you do is you explain the diagnosis, justify the diagnosis as well, and justify it with the history, justify it with examination, justify with investigation as well. And then tell, we'll be doing some further investigations as well. Like in some station, you have to do CT scan, MRI scan, endoscopy, colonoscopy, bronchoscopy. Mention about that thing as well, right? And then you give treatment. Symptomatic treatment, specific treatment. See, guys, don't take symptomatic treatment for granted. I've seen a lot of people, they take symptomatic treatment for granted. Like in the beginning, patient says, "Oh, I'm in pain." And you're like, "Okay, I'll give you painkiller, let me assess you." And you forget giving painkillers in the end. It's not good. Don't forget symptomatic treatment, actually. Right? Don't forget symptomatic treatment. So if patient is in pain, say, "I'll give you something for your pain. I'll give you something for your nausea. I'll give you something for your cough." Mention that. You'll get marks for it. And then specific treatment, whatever the case is, you do the specific treatment. Medical treatment and non-medical treatment. So medical treatment first or non-medical treatment first, guys? Medical treatment first or non-medical treatment first? Depends on the case, depends on the case, depends on the situation, you will go accordingly. Then decide if you want to admit the patient or you don't want to admit the patient, right? So if you're sure, admit, admit. If you're sure, discharge, discharge. And if you're not sure, take the help of your senior. If you have admitted a patient who was supposed to be discharged, okay. If you discharged a patient who was supposed to be admitted, is not okay. So be very, 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 very careful on that. All right. Do we have to provide symptomatic treatment then and there at the end of the consultation? Yes, I would say give symptomatic treatment once you have made your diagnosis, once you're done with the examination and all. Because if patient has got pain, do you really want to give painkillers in the beginning? I don't want to give painkillers in the beginning. Why? Because if you give painkillers in the beginning, what can happen? You may mask the finding. For example, your patient is saying, "Doctor, I've got pain in my knee." So you don't want to give painkillers because then you may mask the findings. So it may not be a good idea. So just be careful on that part, right? So that is really important. Yeah. What else? So, uh, if the patient is in severe pain, should we offer the painkillers in the beginning? I won't recommend you. Just tell the patient, are you comfortable to talk? No, doctor. Okay, I'll give you painkiller. Let me assess you quickly. So do the assessment quickly and then offer painkillers. But if you feel like patient is not letting me do any history, then maybe you can give painkillers in the beginning as well. Rarely. For example, patient has got headache. We know I'm not going to palpate the head. So you might be giving painkillers in the beginning as well. So how do you mention? You mention it to the examiner that I would like to give painkillers to my patient after ruling out allergies and contraindications. And examiner usually says, "Assume doctor you have given," and then you move ahead in the consultation, right? So if you have to if you're not very sure, and just mention in the end, and I'll also speak to my senior, they'll come and assess you. So that's how you can mention about your seniors as well. Do I need to mention about seniors in all the cases? Not really. If you really need their help, mention. If you don't need, then it's fine. Do we need to tell the dosage and everything for the medication? Not really. Not really. No, it's PLAB2, come on. It's easy, man. You don't need to do that. And how do we know it's an examination station? So when you enter into the cubicle, see couch is there or not, mannequin is there or not, because some examination can be done without couch as well. So it's not always couch, but sometimes some mannequins are there, some instruments are there on the table, like eye examination. So you might see Snellen's charts and all. So just check when you go in, just scan the room, what I have been given in the room. Just check that, and that will be quite helpful, right? After that, what you have is as I said, management must have follow-up, must have warning sign, right? O2PT is occupational therapist, physiotherapist. So if patient need any physiotherapy help, you can mention occupational therapist. If you need to make some changes in the patient's house, who does that? Usually it is done by the occupational therapist. All right. Warning signs, red flag, and leaflets and the pamphlet. Leaflets and pamphlets. So, many times you will see you may not be able to finish things, isn't it? It's going to take time. So what to do in that case? So you can mention, I'm going to give you some leaflets. You can read about it, and if you want to discuss anything in detail, we'll be more than happy to do that. Right. So that is how you have to give your management plan. All right. Uh, can somebody asking, can we take the notes? Are we allowed to take the notes? What do you think? No, guys. You won't have pen and paper in the cubicle, so no pen and paper. So you don't have the time to write. You have to write it here in your head, right? That's how it is. Right, so that's the basic introduction, I would say, for PLAB2. I mean, these two slides, I tried summarizing it for you, like what is history taking? That's the main thing. Can we refer the patient to the NHS websites? Yes, you can do that. For the diagnosis and all, you can definitely refer the patient to the NHS websites. They are patient-friendly websites as well. Right. Could you please explain if your online course would suffice until I would be able to get the visa and attend your face-to-face course? Okay, let me talk to you about our course, what exactly it is. So now you can put all your doubts and I'll be more than happy to answer. Right. So first of all, I'll explain a bit about the course, how the course is run. So that will be easy for you to understand. All right. Uh, each resting station. So rest station are also for 8 minutes, doctor. Because see, 18 candidates will start the exam, 16 will be doing the station, 2 are resting. So rest station is also of 8 marks. Do you recommend face-to-face classes or online are sufficient? See, face-to-face classes are always important, but it depends if you have got any visa problem or something, then of course you can go with online, right? So, but face-to-face is something, of course, we recommend because you tell me one thing. When you are doing face-to-face, you are in the class listening. Online, what happened? You're listening for half an hour and then you feel a bit tired and also you feel dozing off a bit. That is the main thing. Yeah. So if you attend in person, that would be much better. But of course, there are visa issues and all, then of course online. Or you can do one thing, attend it online first, and when you come to the academy, if you have less time, just attend in person specific classes which you feel you're not able to do perfectly online. I think that would be the best thing. Yeah. And now I would like to tell you one thing. So what we have, when you enroll into our course, what you get. Some people, they're not able to understand the difference between recorded course and online course. I'll make it clear for you. See, recorded, when you enroll into the course, you'll get the access through our application for pre-recorded videos. We have got pre-recorded videos, topic-wise we have uploaded, like medicine, this is cardiology, this is neurology, this is nephrology. So what you can see whenever you have time in the day, night, just see those videos. Theoretical videos, you'll get theory idea about PLAB2. Because first of all, of course, we need to know a bit of theory before we start practicing, isn't it? You need to know what exactly it is. So we have got around, say, 40 to 45 hours of video which are covering the whole PLAB2. These are recorded ones. So what you get in full PLAB2 course then when you enroll, so you get pre-recorded videos. Then it says online course, 12 days face-to-face course. What does it mean? See, all our live courses, whatever live courses face-to-face we are doing, it's going to be live telecasted as well. So when you attend it in person in the academy, that is face-to-face course. But some users, they are attending the same through Zoom online. For example, today you are attending this course, today's session online. So that is online course, but it is live. I'm live, isn't it? I hope I'm live. You don't think it's recorded, so it's live. So pre-recorded videos you're gonna get, that is separate. But face-to-face course when you are in the academy, that is face-to-face course, right? And as I said, that's face-to-face course, it is going to be live telecasted, so you can attend that live course from your home as well, and a part of online live course, right? So in full PLAB2 course, you can attend 2 times. We give you the access for online course as well, and we give you the access, like when you're in the academy, you can attend it again 2 3 times. That's absolutely okay. And unfortunately, if you're not able to pass the exam and you need the access again, we will definitely provide you. So you don't need to worry about that. And to be honest, this exam is not about attending the courses again and again. Attend it once or twice nicely, and that's enough. The main time is you need to spend on practicing. Practice, practice, and practice, right? So I hope you are able to understand what is pre-recorded and now what is online live course and face-to-face course. With the course, the full course, you are entitled for 2 mocks as well. 2 mocks are included in the course. And the mocks are going to be like the exam, full 16 stations. It will have examinations, mannequins, history taking, everything. It will have sim man, prescription, everything it will be having, right? So you'll have the examiners, they will give you the feedback as well. So you'll get 2 kinds of feedback in the mock, after the mock. One feedback soon after the mock, verbal feedback you will get, and the next day you will get a written feedback as well, like GMC. So you'll get the written feedback as well, like in this station this is what you did in data gathering, in interpersonal skills, in management, where you can improve, and how many marks roughly you can get in this. So that is the thing. So 2 marks with proper feedback. Then you get our books as well. Our books. So we have got volume 1 and volume 2, which includes all the like 500 scenarios, PLAB2 possible scenarios. So you will get that thing as well. Then new station and latest updates. So anytime any new scenario, new topics is gonna come, that's not your headache. You don't need to worry about it. So what's gonna happen? We will be able to update you on that. So we do time to time, every week, every 2 weeks or every month, we do the webinars, the new updates as well. So you will be getting the links for that as well. Simman practice, mannequin practice, academy study area. So Simman practice, so of course Simman will be done during the course as well, but every week you will see like the practice sessions are happening. You can join anytime, as many time you want, you can join those sessions. Mannequin practice, of course, there are supervised mannequin practice are also happening. What does it mean? So some teachers, so what's going to happen on daily basis, you will have some activity going on in the academy apart from these 12 days course. So in 1 week, for example, one day you'll have the session for the prescription. So we'll call the candidates and we'll give them the prescription paper, and we put the timer and we'll give them the scenario and we'll tell them to do it in that 7-8 minutes time. Another day, okay, we'll be doing Simman session. So you guys can come and practice on the Simman. Number 3, another day is a mannequin. So another day we have the procedure section. So we'll be teaching you the procedure, and if you've got any doubt, you can ask. Then you have got examination practice session. So examination, you can practice with the colleague, with your teacher as well. That's what's going to happen. Another day you will see like we are actually doing self-practice sessions as well. So like 20-30 people is going to sit, going to practice with each other, and our examiners, our tutors will be observing them and giving them the feedback then and there. So that's happening as well. So face-to-face classes are happening. With the classes in the practice area, these activities are also happening. And can I practice in the academy with the mannequin? Yes, mannequins are lying. Mannequins are there in the practice area. Anytime, 24/7, you go and practice. Right. So what I was telling is supervised practice. So every day we have some activities going on. Apart from those activities, apart from this 12 days course, what you have is you have got 24-hour access to the academy study area and the mannequin area. We have got your support till you pass. We are going to support you and all the candidates. So if you, for example, you enroll into the batch starting from 2nd of Jan, so we actually make a WhatsApp group for all the batches as well. So that in the WhatsApp group, we keep on doing the discussions. So if you got any doubt and all, you can put it there, and the faculty will be there as well, and the other candidates will be able to answer. So that's how our WhatsApp group runs. And what activity is going to happen tomorrow, day after tomorrow, that will be the updates will be given to you in the WhatsApp itself. And the main focus that we do in our PLAB2 courses, we actually practice with the candidates. So today, for example, I gave you this brief overview. I was the one talking, isn't it? It's not going to happen in our course. What we do is we give you a bit of overview about one topic, and then what we do, we practice with the candidate. We tell you a bit more about like cardiology. I'll explain cardiology quickly, like in 20 minutes to you, and then we will do the relevant scenarios. Then I'll explain quickly, like say respiratory medicine to you, and then we'll practice 2-3 scenarios from that. So because in the exam, what is it? You have to practice only, no? So that is the main thing that we do in the exam as well. So our course is uh, our course is like 649 pounds actually, but if you are a group of five, you will get 100 pounds off, and if you're a group of 10, you will get 150 pounds off. So even actually in 500 pounds, I mean 499 pounds, you'll be able to get all these activities which are in this recorded videos, online live course, face-to-face course, mocks, books, news station updates, Simman practice, prescription, mannequin practice, 24/7 access to the academy areas, practice WhatsApp group, everything is there in this thing, right? So these are the things included, right? So this is what we have explained a bit more in this. Let me take some questions as well. Will there be any pickup service from airport to the academy? Not really, doctor, but you know, Uber works everywhere. So you can book the cab from Uber. I think that would be fine. right? Please add more to the introduction if still remaining. See, when we do the introduction, doctor, in the class, I usually spend around 3 hours. Today I did it in 1 hour, so it was a like a quick overview. That's why we did so that we can take the questions also from the candidates. Unfortunately, none of your course coincide with the kids' half-term dates in the UK. So, doctor, what you can do when you attend the course, I know when you start attending, you may be able to attend half of it. That's fine. Half of it, attend with the next course. That is, you can do. You can attend it half in 2, 3 batches as well. That's fine, isn't it? Will you provide invitation letter to support UKVI application? We can do that. That's absolutely okay. But the thing is, see, none of the academy can sponsor your visa. You're coming to this country to give PLAB2. So when you write your cover letter, highlight your PLAB2 exam. Can we give a letter? Yes. Due to visa, I have only 10 days before the exam. Is possible to do mocks with you? Yes, yes, of course. You can do the mocks in those 10 days as well. So what I advise you to do is attend the course online first. Attend the course online first. And when you come here in those 10 days, give your mocks and practice on the mannequin. That would be better. And if you want to just enroll into only mocks, that can be done as well. All right. Can attend face-to-face classes 5 months before? Of course, why not? You can, definitely. And I would advise you to do, because once you're done with the face-to-face, you will get the orientation of PLAB2, and then you'll be able to practice amongst your colleagues and all, and it's going to be very easy and convenient for you. Right. So what's included? What we said is two times online live course, 2 times in-person course, 12 days course, full mocks, PLAB2 recorded videos are there, access to self-practice sessions, examiner procedure sessions, sim practice session. Everything is included, right? Now, what we have made is practice until your exam, hard copy of PLAB2, that is definitely WhatsApp group, everything you have. Now, so there are some discounts, as I mentioned, it's going on. So this is also exciting. We actually completed our 6 year day before today. We did a small get together, a party in the academy as well. We had our lunch with all the candidates. We did cut 6 cakes as well because of 6th anniversary. So we are giving a giveaway on the 6th anniversary of Aspire. So the candidates, because we know the result came on 14th of December. So who has booked the course or who is going to book the course from 14th of December till 1st of Jan? So what's going to happen? So if you're booking in a group, so group of 5, it is for 549. Group of 10, it's going to be 499 you will be paying. And 6 lucky winners will be doing a lucky draw, and the 6 lucky winners will get 60% on our 60% off on the course. So for example, you booked in £500, right? So, and if you are the lucky winner, if you're the lucky candidate, so 60% of 500, that's going to be 300. We will refund you in your account. So that's going to be there. So it's valid till 1st of Jan. So this is for the Aspire anniversary offers. I would say go and avail it, right? So 6 lucky candidates will be able to announce after 1st of Jan, maybe on 2nd or 3rd or 4th of Jan. We will compile everything and we'll do the lucky draw. We'll do it live. We'll do it Facebook or Instagram live. So there won't be any discrepancy and all in the lucky draw winners. All right. Perfect. We guys can make like get together as well, and you can make a group of 10 together as well. So this is a link to the WhatsApp group where a lot of other candidates are there. You can just club together and make a group of 10 and book the course as soon as possible. So that is quite useful, isn't it? So here is a link. So I'm just waiting if the candidates can join. You can just scan it. Can we get to the academy a few days prior to face-to-face classes? Of course, doctor. When you are enrolled into our course, most welcome. Any day, anytime you can come. Will there be sufficient time for history and examination and management? Will there be sufficient time? You mean 8 minutes? Yes, it will be sufficient. So this is what we're going to tell you, how you can manage your time properly. I know when you have history, examination, management, you think it's too much. I agree with you, but it's a way how you can do things quickly as well. That is what we're going to tell you. Can we take only theory classes without the academy for a low cost? Yes, if you want to enroll into the recorded course. You can also enroll into our only and only recorded course as well. Just find it on the website and you can enroll into just the recorded course as well. Yes, that facility is there. Or what you can do is just enroll into the recorded course and see how it is and then come for live as well if you feel like. Yeah. So yes, that facility is there as well. Live online is very helpful as well. Of course, it's helpful. Yes, yes, yes. I mean, see, the candidate, those are not able to come in person. So definitely, I would advise them to attend online live, and it's going to be useful, my friend. Is there an hour limit for the recorded videos, the number of times we can watch it? Yes, we have put a condition as well. So you can watch it roughly around 2.5 times, which is more than enough, my friend. And, and a lot of videos, you won't be need to see it again. Some videos you might be thinking that you want to see it again. So that's why we have given like access. So roughly 2.5 times you can see it, right? What's your advice? First watch videos or read notes? I would say do both together. Do both together. And to be honest, if you enroll into the course as well online live, you'll be able to understand things in a better way. You have to do all things together. Don't just read. Come on, if you read 1200 pages, do you think you can retain it? It's difficult. So what I want you to do, see some videos, read the notes as well, and attend the online live course where you'll see other practicing. So you have done the theory and you have seen the things in practice as well. That is how you should practice. That is how you should prepare. Do everything together. Was the timing for the candidates to practice in the academy who doesn't live in the Aspire letting? So it's 9 to 5 o'clock, doctor. For the winters, we have made it this time, and the summer we might change it 9 to 5 for those who are not living in Aspire lettings. Another thing, I've got some announcement for the accommodation as well. If you have booked our course, we have got a big announcement for accommodation as well. Just give me a sec. I hope you have joined the WhatsApp group. I'm gonna change the slide now. How many months before I should come to Liverpool and Blackpool, doctor? Blackpool. I would advise if you can come 6 to 8 weeks before, that would be better. I booked for Feb batch in Aspire. I have my exam in April. I'm planning to attend online course before that. Do you think when I come in February, would it be better idea to attend classes or practice with the exam goers? So what you can do, doctor, attend online classes now, maybe in January. And then when you come in person in February, just see which classes I need to attend in person. Attend those and rest time spend in practicing, practicing, and practicing. I want live telecast the theory, but not need for the academy. I want the live telecast of the theory, but not need for the academy. We don't have any that kind of facility, doctor, because what we want is but if you want only the live thing, so you don't want the mocks, you don't want the practice in the academy as well. So you can email, we can actually help you with that as well. Just email us to info@aspire2plab.com. We can create a package for you separately where you will be getting that only and only to attend our online live course. That can be done as well. No worries. Ideal time to register for the full course. See, ideal time is, I would say, do it before 5, 6 months before your exam. So you will have enough time. So spend daily 1, 2 hours in recorded videos, reading the notes and those things. Why you just want to book it just before the exam? Don't do that, right? So my advice would be do it as soon as possible you can. So you can do it slowly, slowly. You can attend once online course. You'll get the orientation. Then you see the recorded videos. You can read the notes, attend the course again if you can, and you'll see you'll be better prepared. That's our website, the Study Genie. The things can be booked from here. Now, this is the accommodation offer I was talking about. Have a look. So, we are offering a few days free of cost in the accommodation. As on the 6th anniversary, we are celebrating Aspire. So, in the courses, as I said, 6 candidates will get 60% off. Those are booking from 14th till the 1st of January. Now, so those are the doctors booking the accommodation for more than 28 days, because there are many booking for 2 months and all. You will get 6 days of free accommodation. Those who are booking between 14 to 28 days, you will get 3 days of free accommodation. All right. But make sure to qualify. Of course, you have to book full PLAB2 course first. That's the thing. And make sure you are booking the accommodation for more than 14 or 28 days. And you have to book the accommodation before January 1st. So all these offers are valid till 1st of January. Right. So, yes, I would say, I mean, why to leave this offer, isn't it? I mean, you can book the accommodation maybe for March, April, May, June, whatever time, of course, you can, but book it on or before 1st of Jan, and you'll have these things, right? I hope this is helpful. Yeah. Do you offer just mocks as package? Yes, doctor, we do that. You can email us and we can help you with the only mocks package as well. What does the two times means? Meaning is if you're attending online live course, we give you the access two times. So you can attend once in January, once in March, April, whenever you want. And you can attend two times in person. That is the meaning, doctor. How many classes for face-to-face session? It's 12 days, doctor. 12 days face-to-face, and all the 12 days will be live telecasted for online users as well. Does it mean we can watch any batch of the online course you conduct apart from the one we are planning to do in face to face? Yes, of course, of course. So the batches dates are there online on the website. You can check. Like the next batch is going to start from 2nd of Jan. So you can attend those in person or you can attend those online. It's entirely up to you because it's going to be live telecasted. Yes, doctor. Do you have accommodation support in Manchester for the main PLAB exam? No, doctors. One thing is, you can go on the same day of the exam as well. It's a 60 minutes drive. And you know what a lot of candidates do? They do book the cab together and then they go together actually. So on the day of the exam also you can go. Or else there are some hotels that we can suggest you that you can book one day prior to your exam, right? Do you have provisions for accommodation? Yes, doctor. Yes, yes, yes. So these are the things why you should be in our accommodation. So you will get lot of things if you stay in our accommodation. For online course, will we be given a dedicated time because it's live? Yes, the live courses for the face-to-face courses or online live course is gonna start from 10 o'clock UK time, 10 o'clock UK time, and it's gonna till 5 or 6 o'clock UK time. So that's the timing, right? So if you are in your country, or in India, you're in Pakistan, you're in Sri Lanka, in Egypt, in Libya, right? So whichever country you're from, just calculate the timings accordingly. Yeah. Do we need to book for online course dates? Yes, if you just email us, for example, you have booked the course and once you book the course, you just let us know, I want to attend this course as online and we'll give you the access. That is it. After just an email and within 12 hours, you'll get the reply from our side. Was this distance between Blackpool and Manchester? So doctor, it takes 60 minutes by car and maybe 90 minutes by public transport, right? 150 off each for a group of 10. Yes, every single candidate will get 150 pound off. So that's our website, guys, for our accommodation, ankleaspirelettings.com. You can scan it, or if you want to just type this, you can find the rooms. We have got 4 accommodation. We have got one big building, and there are the 3 other hotels nearby. We have got each kind of room, whatever you are looking for, you will get it, right? So all the rooms are en suite, and they have most of them. They have got the kitchen facilities as well. So every single thing that you want, I mean, to study that you'll have, isn't it? I'm not saying it's a 5-star accommodation. What we have tried doing is we tried giving the best cost-effective accommodation to the candidates because I know when you come from all these countries, we are a bit tight on our budget as well, right? So we have got accommodation considering that thing as well. So you'll be getting the accommodation from 16, 18 pounds till 25, 30 pounds, depending what you want. I mean, you want a share room, you want single rooms, so accordingly the pricing are there. And we have got some what do you say? Very like high class accommodations as well, some rooms. So if you want, you can book that as well. It depends on what you want, as simple as that, right? Will be able to attend the online classes maximum 2 times? See, doctor, if you want third time as well, we have never said no to the candidates, right? It's just like if somebody are abusing the system, then it might flag up in the system, but otherwise, even if you want more than that, we have never said no to the candidates. Your course is expensive for international students. What does it mean? No, it's same, doctor. International students. You mean if you attend the course in your country, is that what you mean? Yeah, that might be. For example, uh, if you're attending our course, say we do course in Turkey, we do course in India, we've done courses in Dhaka, Bangladesh, we do in Egypt, we do in UAE, we have done in Pakistan, we have done in Nigeria. Right. So when we do the courses in these countries, what happened? We slightly increase the pricing for the course because we have to cover a lot of other expenses as well, isn't it? We have to travel, and when we travel with the mannequins. We travel with the mannequins. We have got our travel costs included as well. We have to book the venue as well, and book the accommodation. So all these things, that's why the course pricing may be slightly high when you do the courses overseas. Another thing, guys, if you feel we should do the course in your country, we'll be more than happy to come. Right? We have more than the next dates for the Turkey and India we have announced, but if you want us to do the course in any other country, and if there are 20, 25, 30 people, they come in a group and they want us to do the course in that country, we'll be more than happy to do that as well. Just reach out to us on the WhatsApp group, and we can do that. We'll come to you. Because if you have got problem like, okay, visa problem, visa is just 10 days before the exam, but I want to attend in-person course, we can come to you. You can invite us. Right. Wondering when to follow the online course when the exam is in June. So if your exam is in June, attend the online course as soon as possible so that you understand what is PLAB2 in a better way, and then you will get in practice. So I would say attend online in Jan or Feb. Be quick, right? And then practice a bit online, and then you come maybe 1, 2 months before exam and attend in person as well, right? Is the SIMMAN as the same used by GMC? No, doctor, our SIMMAN is better than the GMC. Don't worry. Yes, even the candidates who appeared for the exam, they said your SIMMAN is much better. The findings are much better than the GMC one. So don't worry, it's the new SIMMAN that we are using. How to get a group of 10 or 5? So you can, put on your WhatsApp groups and all, doctors, so your friends can join together. Or else, if you join this WhatsApp group, there are a lot of other candidates as well. So you will be able to make a group of 10. And guys, see, what we want you to do is get this course done as soon as possible, get this exam done as soon as possible, because exam is going to be changing. It's going to be UKMLA by the end of this year according to the GMC, and the end of 2024 it might convert to UKMLA. What new things are going to come, we will be updating yourself. We will be updating you guys, so don't need to worry. But I would like you to get rid of this exam beforehand only, isn't it? When you're done with PLAB1, why are you waiting? So the next few months, make sure you get your exam done. That would be the best thing. Please upload this video on YouTube. Yeah, we'll see, doctor. We'll edit it and we'll try to upload it. Yeah. Could you reconfirm how many face-to-face and how many online we can participate with the full course? See, doctor, even candidates, we say 2 times online, 2 times in person. So in total, 4 times. But even if you want fifth time, I won't say no to you. That's the thing. But the thing is, it's not about attending the course again and again. This exam is about practicing. Attend nicely 2 times. It's more than enough. But yes, even if you want later, we will give it to you. Difference between Manchester and Blackpool accommodation. No, doctor, we are not providing accommodation in Manchester. We're providing it only and only in Blackpool. Right. Okay. Do you provide accommodation? Yes. How long before the exam do you think we should arrive in the UK for your academy? So if you have attended online course, live course already, then 6 to 8 weeks, if you spend, you'll feel much better. Right. I mean, some candidates they can't spend, then it's a different thing. But if you have the visa and if you have got the time, 6 to 8 weeks, if you spend, you'll feel much better, much more confident for the exam. Exam is in July. When do you propose to take the academy? I would say as soon as possible. Get your online live course done once. You will feel much, 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 much better. Can you modify your April course from 1st till 12th? Doctor, that's not going to be possible because you already have got the bookings and everything has done. Right, so it won't be possible. Let me check what are the dates so I can suggest something maybe to you. Right. Can we avail 2 offers together? No, doctor, only one offer. I think this offer is enough, isn't it? We can't go more than that because we're giving you courses, online live course, in-person, face-to-face course. MOOCs are included, books are given as well. So I mean, everything will be included. So I don't think so we can go beyond that. So no, two offers cannot be availed together. So the dates are in April. We've got it from 25th to 5th April. So maybe you can attend few days in that one. And the next is from 15th of April. So you can attend maybe few days in there as well. Yeah, your session is very helpful, isn't it? Thank you, doctor. Doctor, I didn't know that there is a fixed time frame on the Study Genie website. What do you mean fixed time? You mean we have given, see, I'll tell you one thing. When you book any recorded thing in any website. So we have to put a time. So we have to put the time for 4 months and 75 hours. After 4 months, what's going to happen is, or before the 4 month time finishes, just email us that my exam date is this one, and we will give you the access till your exam date for the recorded session and the notes. So you don't need to worry about that. But what happens is when we have to and when you have to list the course on the website, this is a requirement of the website. That's why we have put it 4 months. But if your exam is after 4 months, don't worry. After 3.5 months, just tell my date is this one, and I will give you the access till that time. So don't need to worry about that. Is it possible to get only the live classes? If yes, what's the cost? 12 days live. 12 days live in person or online? What does it mean, doctor? That can be done if you want. To be honest, every main thing is this one. Mocks and all are included a part of it. But if you want only the classes, just email us and we'll be able to tell you that. No worries on that as well. When you subscribe for a course in April for online course and want to revisit the same course for exam in June, do we have to need to repay? No, 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 no. Your subscription is valid for next 2 years. Don't worry. You don't need to pay again if you're attending the course again, doctor. Can we extend the date of the subscription? Yes. How to book in a group? So when you make a group of 10, just email us and we'll let you know. Or just join this group and we'll guide you. Our admin is there in this group, in this WhatsApp group. Just come there. We'll help you in getting that. So don't worry. As it said, it will expire in 49 days for Dr. Khan. Don't worry, doctor. So maybe 10 days before it is about to expire, just email us saying my Study Genie subscription is going to expire in next 10 days. My exam date is this one. We'll give you the access. Don't worry. For how long is the access given for pre-recorded lectures? Till your exam, my friend. Don't worry. Is it 100% void for Plabbable? Yes. So if you are Plabbable subscriber, Plabbable is our partner, Dr. Z, Dr. Adam. So yes, if you are a Plabbable subscriber, you can get £100 off. If you're a group of 5, £100 off. If you're a Plabbable subscriber, £100 off. If you've got a group of 10, £150 off, right? What one offer at a time, my friend. Do you use the same SIM as GMC? I think we've answered that. What is the procedure for joining a group? Just join this WhatsApp group. We will help you. Accommodation, we did mention that as well. Live online course alone, I mean, without the academy, how much it's going to cost? So it's going to be around, do you want recorded or not? If you don't need recorded, so we can give you the access in around £200, doctor. Just email us and we'll give you the thing. Right. For accommodation, what you have to do is, this is our website. See what are the rooms you want. And what you can do is, you can actually put the request through this website. And then our admin will get back to you with the availability and will give you the free accommodation for 3 or 6 days accordingly. All right. Appreciate your time. Thank you. How many days can we attend the in-person? 12 days. Yes, 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 12 days. How many days max can you practice in the academy? Till your exam, doctor. Till your exam. You don't need to worry. Till your exam. I only have 3 weeks annual leave for PLAB2 exam. I don't have the time to attend online revision and 2 weeks in person before the exam. Do you show recording of the light video for someone like me who can't attend the live course? See, Dr. Sophia, so for you, what we have got is the pre-recorded videos, isn't it? So we cannot give you the access for the live sessions recording because there we are practicing and the candidates we are practicing with might not be comfortable sharing their video. That's why we have got pre-recorded sessions that you can see. And maybe you can get the access for our online live course as well. So what happens is whatever 2-3 hours in a day you can manage just to see those things and you will get the idea. I mean, can 15 days be 12 days course and 3 days for the mocks? I can understand. So, see, 12 days course, mocks are separate. Mocks are not in these 12 days. Mocks you'll be giving before your exam. So maybe your exam is in July, for example. Attend the course now in Jan or Feb and give the mocks 2-3 weeks before your exam. That's how it's going to be, right? How long is the registration valid? Don't worry, doctor, till your exam, until you pass. How much is the accommodation per night? So as I said, it's from 18 pounds till 30 pounds. It depends what kind of accommodation you want. Single room, double room, twin room, like premium accommodation or normal. What kind of accommodation? There's a lot of accommodations available. Just go on this website, Ankur Aspire Lettings. You will get everything, pricing, everything that you mentioned on this. Can you practice on the mannequins in Simon even after the batch dates are over? Of course, that's what I said. Classroom is different, practice area is different. Practice area is accessible 24/7 for Aspire Lettings candidates. Anytime you come and practice on any mannequin. We have got supervised session happening on daily basis, but access to the mannequin is 24/7, guys. Can you extend the stay at accommodation after initial booking? Yes, you can. But the thing is, we have to see I mean, availability, if there is availability or not, isn't it? So you may not get the same room and all, but if you book it in the beginning, that's better. But of course, when you come here, you can speak to our accommodation manager and they'll be able to help you out. Can 15 days be split? 12 days per 3 days later for the mocks? Accommodation, you mean? So, okay. Yes, if you're booking it now, we can help you in that. Okay, yes, of course. Is there a car parking in the accommodation? No, doctor, no, doctor. This is the UK, isn't it? So, the accommodation, sorry, the parking is the biggest problem, right? So, not really. So there is parking, but it's paid. The parking is run by a company actually, and if you park there, there's like around 20 spaces around. I mean, in our academy premises, but it is run by, as I said, a company. So if you park there, you have to pay for it, right? But the parking is there, yes. Can you attend face-to-face course in April and come for the mocks in May? Of course, yes. Is there 100% PLABable? That's done. As per the criteria for the group of 10 discount, will I get discount or not if anyone drops out? So the thing is, all 10 has to pay within that window in 24 hours or 48 hours you have to pay. And if somebody backs out, you have to find another candidates. Otherwise, yes, you may not get the benefit of group of 10, right? So that's a join this WhatsApp group. You will get help from our side. When's the next course in India? We're planning, doctor, in February. Tell me, guys, if you are interested that we should do course in your country, let us know which country you want us to do the course. But of course, we want the things from you as well. We want some candidates as well. So when we have 25, 30 candidates, it's going to be easy, right? Okay, Dr. Tawfiq Hussain, Dr. Sri Sai, what do you think? What dates is going to be suitable for you guys for doing a course in India? We're planning to do in end of Feb or beginning of April. That's what we are thinking. How long the subscription valid? My exam in September. Don't worry, it's valid till your exam, doctor. In the cover letter you mentioned, do we have to mail you individually? Yes. Just email us that I'm coming on this date and I'm attending this course. So we can put those information on the letter, your full name as per your passport. So just give us those details and email us at info@aspire2plab.com, right? Does the face-to-face PLAB course involve online classes as well? And if yes, how many? Yes, so our face-to-face 12 days course is live telecasted. So online face-to-face, online live course 12 days. Face-to-face 12 days, of course, because it's the same, right? It's live telecast of it. Could you kindly answer my two questions? Is there car parking facility in your accommodation? Yes, there is, but you have to pay for it. And is there 100% off for PLABable account holder? Yes. Please show your QR code for accommodation. Uh, 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 the accommodation QR code is this one. That's for the website one, actually. So you can just join it here. Or if you've got any doubt, just come in that group only. We'll be able to help you. How many months enough for to prepare? At least 2 to 3 months, doctor. Do you teach daily in the academy for face-to-face classes? Doctor, I need to do some other things as well. I do most of it. And my friend, my partner, Dr. Nikhil, so he does some classes. So we both do the full course. Right. 10 to 5 with academy access sufficient. Uh, I mean, if you are in our Aspire lettings, you have 24/7 access. And if you're staying outside, 10 to 5. So, of course, I mean, if you're coming at 10, 7 hours, if you're able to practice on the mannequin, I think that's fine as well. But if you're on 24 hours, you can avail in Aspire accommodation only. Is it possible to do half the course in first batch, another half in different? Of course, yes. Can you plan the course in Pakistan or Dubai from 1st of April? See, doctor, it's going to be difficult for me to do in Pakistan, but in Dubai, definitely we can do. We can definitely. From 1st April to 12th. See, I can do, doctor. One situation now, one condition, Dr. Masood. I need some more candidates as well. If you can make a group, like, say, around more than 25 people, I will do a course in Dubai in your dates. Promise. Right? But as I said, we need at least 25 people. So just check in the groups and all, see if people are happy. So we can definitely run a course in April in Dubai. How do you give books, hard copy or soft copies? Both, doctor, both hard copies as well as soft copies. You'll get both. Yeah. So when you book, you'll get the straight away access in the study journey. When you come to the academy, you'll get the hard copies as well. And if you want us to courier the copies to you or address, we can do that as well. Yeah. Does the full course cover online and face-to-face? Yes. I have registered for April face-to-face course. Can I come for the mocks in May? Of course, of course, of course. First, what you can book the mocks as well. You have to book your mock dates as well. So book the mock dates and accordingly you can come. Right, thank you, thank you. Sorry to bother you again, no worries, but I have my friend who already booked the accommodation near academy, so I'm asking this academy access query repeatedly. Yes, doctor, so if they have booked the accommodation, so they might have paid the initial amounts, isn't it? And we are giving 6 days free as well, so I think they can book here as well. And maybe you can book with your friend in the same accommodation, isn't it? Book in any of our Aspire accommodation and you will get the access 24/7. Right. Thank you. Cost of accommodation. So it's go, doctor, from 16 pounds till 30 pounds, depending what you want. And just go on this website. Practice area access timing for people living outside, 9 to 5 p.m. Is your PLAB subscription has expired? You will still be eligible. Yes. 16 station. Is there a breakdown example to? Yeah, it is actually not followed in every single exam, but three ethics, two, three counseling, two, three examination, one simman, one prescription, two medicine, one surgery, one gynae, one peds, one psych. That's a rough breakdown. Can you please suggest a prepare plan like face-to-face classes? Advice is the exam is in July. So my advice would be attend the online live course as soon as possible. That's the first thing that you should do. After you're done with that, so you have the notes. So read a bit of the notes. Read something like make a group of 3 people, make a plan. Tomorrow we're going to practice cardiology, first 5 station from counseling, first 5 station from ethics, and 2, 3 examinations. So in the evening, read the notes about it. See the recorded videos if you want, if anything is not very clear. And the next day practice. Those 2, 3 people, maybe online, you can practice. Keep doing that for 15 days. You will see you're done with the whole syllabus in 10, 15 days only. Right? That's the main thing that you need to do. And after that, what you're going to do? I mean, the come for in-person classes. If you feel like a sim man examination, I need to attend in person, and then practice again and again and again. Right? All right. Okay, so just a sec. We have got Dr. Asad as well. Mhm. NCP parking is there. Yeah. Can we attend the course in India and then come to practice in the UK before exam? Of course, of course. That's what we do actually. So we would like you to attend the course in your country and then come to the UK and attend it again, my friend. That's the thing. So that's what I'm saying. If you would like us to do a course in your country, we'll come there, attend the course there, then attend again in the UK. You'll have the online access, everything, right? India, yes, Dr. Sobia, Dr. RM, Dr. Rohit. So we got 5 candidates already for India. Do one thing. First of all, do one thing. Come in this group. This one for the group discount, and come in this group, and we'll see if we get candidates who wants to do the course in India. So we can make a separate group for them, and we'll see if that's possible. Yeah. The dates we can decide, my friend. Dates we can decide. That's not a problem. I was thinking maybe doing it in early March or late February, or if you want some other dates, we can do that as well, depending on your thing. So just come in the group and we'll see. You don't have to have a valid subscription for PLAB, even if it's expired, that's fine. For India, I will suggest ending of April or early May. Just come in the group and we'll decide, doctor, all of us. The link is also been shared here. Guys, can you make a group for India now? Yes, yes, we'll make. So just come in this group, in this one WhatsApp, and then we can place the group WhatsApp group again for India course and other country course. For Dubai, it will be 750. I'm not saying it's 750. We'll see, doctor. We'll see. It depends, how many candidates we'll get because Dubai is expensive and arranging it will be a bit tricky. We'll not make it 750. We'll make it a bit. Of course, see, the course here is 650 pounds. We're giving some discounts. So not 750, maybe 650 or something. And maybe we might not allow much of discounts in our overseas courses. But don't worry, don't worry. Get some candidate, as I said, Dr. Masood, it won't be 750. We'll make it cheaper than that. Don't worry. Are the courses done in India completely at per those outside? Of course, of course. Don't worry because it's I or Nikhil. Both of us travel for the course and will be doing the course. If I book the course in Blackpool, can I change it to course in India? Of course, yes, of course. If you already paid for the group of 10 discount and don't pay what happened, and all don't pay, you will not get the access, my friends. If out of 10, 9 paid, then what we would like is get another candidate in that group and sort it out. That's what we want, right? I mean, in the UK, is India course as per with the UK one? Yes, yes. Who will be doing the course? Nikhil, will be doing the course. No, so it will be same, right? Is your PLAB subscription that's done? How many weeks before the exam date should we give the mock exam? We say 1 to 3 weeks, 1 week, 2 weeks, or 3 weeks before the exam. That will be preferred. All right. Please repeat the breakdown of the station. So, 1 sim man, 1 prescription, 2, 3 examination mannequins, 3 counseling, 3 ethics, 2 medicine scenario, 1 surgery, 1 pediatrics, 1 gynae, 1 psychiatry. Right? What is Simman? Good one. Simman is a talking mannequin. Simman is talking mannequin. It's another mannequin, don't worry. Uh, what do you think is difficult exam comparing PLAB1? No, no, it's not difficult. It's about communication. So if you're good in talking, you will pass this exam. So that's the thing. So that's why we want you to come a bit early to this country so that you just see how the culture works. Because in this country, doctor, sorry, please, kindly, thank you is free of cost. They say it for everybody. So that's the main thing. Yeah. Is an extra charges for the course in India? See, the course price is, doctor, £650, isn't it? We are giving some discounts for the courses in the UK. But if you're doing the course in India, we might not give much discounts. So the course price might be around £650. That's something can be there. But of course, make a group and we'll see accordingly how many candidates we have got, and then we will fix the price for our overseas courses, right? India in May, India in June. Do you have any stats on a candidate pass rate? Yes, yes, we do have stats, doctor. So we were actually making, so what we found is our stat was our 80 to 82% of the candidates, they have passed in their first attempt. That's the stat. I won't say 100% because it's not. When you appear for exam, it's not 100% that you're going to pass, right? If you give 100%, you'll pass 100%. If you give a bit less, then chances may not be there, right? Uh, can you please guide about accommodation, car facility? Does the Facebook and online? That's done. Active or previous? That's done. That's done. How many online courses? Lovely session. Okay, good. Please, can you provide the details on the faculty? I'm the faculty doctor, and Dr. Nikhil is also there. We've got Dr. Asad as well in the faculty. I'm just going to bring him in the screen as well. Dr. Asad, if he can come as well. So, Ankur, it's me. Dr. Asad is one of our faculty, and Dr. Nikhil, he does our courses. Dr. Ame, we have got in the faculty, and there are at least 10 people, those who are doing our mocks. The faculty is big. But you will see the courses, who is doing the courses. I'm doing, Dr. Nikhil is doing, and some of the classes you will see Dr. Asad is also taking. And we go for our overseas courses. So usually one of us travel, I or Nikhil. So we'll be doing the most of the classes, but we have to have a tutor with us as well. So we have got Dr. Ame, we have got Dr. Shivani, and we have got a couple of other doctors as well, those who travel with us and will be doing the courses. And when we do the courses in Turkey, we have got Dr. Barkay as well. He's from Turkey, he's our partner in Turkey. So he does the course with us in Turkey. He doesn't travel with us in other countries, but yeah, he definitely arranges and do the things for us in Turkey. So that's how it is. We have got a lot of people in the faculty, right? It's a mixture of all the specialities and all. So you get the experience of everything in our course. Right. Any other question, you can just put it down. And as I said, come in this WhatsApp group and we'll be able to answer your queries in the WhatsApp group. And we can make separate groups for the courses overseas. For example, the courses in India, in Dubai. So Dr. Masood, Dr. Tan Masood. So what's your job now? Just see if you can get the candidates and we will be happy to do a course in Dubai. Because as I said, it's difficult for us to do it in Pakistan. But definitely we can do in Dubai, right? So even on your dates, as I said, you said 1st to 12th April, I'll do in those dates if you can get that number, right? Appreciate your time and effort. It was really productive. Thank you. And one Simon, ethics is going to be 3 doctor at least and 3 counseling stations at least. That's what we're going to get. Right. Thank you. Yes, we have got Dr. Asad as well. Asad, you want to say something? Any advice from your side?
Yeah, so thank you very much for attending, guys. I know a lot of you have been attending various, you know, webinars and all that. And I think some of you have already come before when we did it as well, like a few days back as well. So yeah, so just wanted a bit of a introduction just for the PLAB2 and mainly about the doubts. That's the main thing. But I would like to reiterate that the discounts and what's available for you guys. So whatever you're booking here, you'll get more than that. I don't know if Dr. Ankur mentioned about the fact that what we do after the course. Course is one part of the journey. After the course, that's one of the main parts of the journey as well, right? So here, after the course, a lot of people are worried that will we have someone answering our questions? If we have doubts, will there be anyone to help us? Well, what we do now is we have a couple of services that we provide also, and that's free of charge completely. So after the course finishes, we force the candidates to join us in our practice sessions, which we call spam, and it's self-assessment practice mocks. And there you have also our tutors as well there, guiding you guys, supervising, also involving themselves. Plus we have the prescriptions, because a lot of candidates, they think that they can do it in the last day, which is not possible. So we get them to do it right after the course they started. Plus, additionally, we have this Simman practice sessions. We do it regularly every week at least. So those who have exams coming up, like in the next week, then they do it this week. And then we have examination practice sessions, procedure practice sessions as well. So we have a lot of things. And additionally, the main thing is that being in the Aspire accommodation means that you'll be able to practice 24/7. I mean, what more do you want, So instead of giving yourself 30 days, you could give actually 60 days, because if you count day and night as well, right? So day and night is 2 days. So what you should be doing is that trying to get your bookings done. Plus, additionally, there's an offer going on, which Dr. Ankur must have mentioned about the accommodation. Please get in touch, email, and our team is there actually ready to answer your messages as quickly as possible. Yeah. And apart from that, there's a lot of other things we are doing, we are changing, we're going to bring out more things as well. And hopefully you will be able to get everything done before the changes that happen with the UK MLA. So we want you guys to just get it done, because you guys are the ones who are going to be most likely taking the exam in this pattern. After that, maybe the new candidates will be taking maybe in the new way. All right, guys. So thank you very much for joining in. I know a lot of you may want to watch football right now, but I do. So that's the reason why, so we're going to say thank you very much for joining in. And if you have any more questions, just email to us. And on the WhatsApp group, if you message, then we can send you a voice note answering your questions. And let others know as well. Make groups, drop a message everywhere, and we'll be able to help facilitate you making groups as well. So we have been doing that. So we help you and you help us as well. All right, guys. So thank you very much. And I think that should be done, Dr. Ankur.
Yes, yeah, that's it. That's it. And thank you so much, all of you. And as we said, I think I got some messages as well. Yes, for overseas courses, just come in this group, and we'll make a separate groups, and we'll see like which country we will be able to do the overseas courses, and the dates we can actually decide. I mean, we can put a poll, for example, amongst the candidate, and we'll see what is the best time and all. So we will see it accordingly. All right. And any doubt, you can just ask in this WhatsApp group. You can email us at info@aspire2plub.com, and you will get the answer. All right. And see you in Aspire. See you soon, guys. Thank you. Bye bye.
Thanks, everyone. Bye-bye.